I hope you're all doing well. Welcome back to the iFitNurse Pearl series. This is video number 10 and we're going to discuss just trach care. Trach care could be very intimidating, especially if it's a new trach. So the first thing is first, you need to know when the trach was placed, okay? And especially if it's a new one, you obviously don't want to irritate it. You want to be very careful with assessing the skin around it, making sure there's no signs of infection or anything like that. So find out when the trach was put in, okay? And then as you assess, again, it's part of your assessment, you want to assess the stoma underneath the drainage gauze, as well as under the ties. Make sure like where the faceplate is, that there is no like excoriation in the skin, no signs of infection. If there are sutures, find out if it is time to remove those sutures, and any breakdown that could occur. Let's say if you have the ties tied too tight, or if just, you know, whatever's going on, it's causing pressure. So that should be part of your assessment, and you should be doing trach care at least once a shift. If it's someone who has copious amounts of secretions, thick secretions, or maybe it's new, it's drainage, you would see a lot of drainage and then some dry blood. So you want to make sure that you are keeping the area clean, again, to avoid infection. A couple things that I've seen that I'm hoping that will help you as you take on trach care. Like any other skill, I don't have the supplies here to show you, so I'm hoping that you utilize your textbook, your nurses, your facilities reference. I don't know, for us it's like literally button on our charting system, and then it pulls up Lippincot's list of skills, and everything has a step on how to do. So there are times where I would go ahead and print that, review it, and have it at the bedside if I'm going to do a skill, or just do a skill I'm not really familiar with. And then even utilizing some visual aids or, you know, videos. And on top of that, you can always work with your respiratory therapist. So they also can do trach care. And especially in the beginning, I remember saying, hey, the actual trach collar Velcro tie is really soiled. Can we change that? And you can work with them, so you can learn how they are doing the trach care. And if there's anything you have any questions on, they are a really good resource. So I highly recommend that you pull your RT aside and just ask them. Even recently, I noticed that a patient with a trach, and I needed to change it. And whenever you do change the ties on the trach, you definitely want to do it with an additional person, so a two-person, to make sure that you do not have the trach dislodged. So first thing is first, make sure you have a spare trach kit with your obturator at the bedside, so should it dislodge, you're able to open it back up and insert it. Even opening one of those kits, you will get familiar with what's inside, and making sure you know exactly what size Shiley the trach is, and then obviously knowing which type of trach they are using. So it depends. Regarding the trach care, you have to go and look at what your facility provides you. What does the tracheostomy care kit include? What does it not include? Do you need an extra pair of sterile gloves? So you can find out what you need to bring every single time. And then practicing the sterile technique like everything else, you know, donning your gloves, making sure that one's hand sterile, one's hand dirty. When you open up your like sterile saline or your hydrogen peroxide, you'll find a way to do it. So for instance, like I take off my tops and they're kind of loose on there without me having my sterile gloves on, because once I have my sterile gloves on, if I touch the outside of the container, it's no longer sterile. See what I'm saying? Definitely kind of figure things out, your setting. I used my bedside table to lay the entire kit out. For us, we have disposable inner cannulas, so I don't necessarily have to go through and clean the inner cannula. I can always get and replace one. So it just depends on the system you're working with. And that's why it's important that you find out what your facility is providing you. So again, like I mentioned, once a shift, you should doing trach care, and you would do it more frequent if, let's say, there's a lot of drainage or anything like that. Definitely follow your orders, especially if it is a new trach. Sometimes they don't want you to touch it, or if there was any complications, they want you to minimize any type of additional trauma to the area, to the tissue there. So follow your instructions, follow your ENT orders, your critical care physician. It will just guide you as to how you treat. And then this goes further on. Let's say if you are going to be discharging someone on a trach, there will be further teaching opportunities that you would have to pass on to the family members, but we're just going to keep it kind of simple. Again, when you do your assessments, you want to make sure you are assessing the drainage color. Is it a lot? Is it bloody? Is it yellow? Is it just like mucus, like salt, you know, is it clear? Looking at obviously the sutures around the plate. Whenever you do your actual trach care, sometimes they need extra gauze, which not only you want to keep whenever you're getting it out of the sterile packet, that the sterile end, which is like the split like dressing gauze that you tuck right underneath the plate and the straps. Again, you want to make sure that it is tight enough so it's secure, so it's not going to dislodge, but not tight to the point where it's causing pressure. And it would end up being a pressure device related type of ulcer in a sense. So you want to make sure that you are always assessing that. If it's someone who's not really alert and oriented, you have to continuously assess. Sometimes they're trying to fight and get out of the bed, and you know, maybe they're restrained, and all of this extra movement could cause extra drainage and trauma to this area. So just depending on what's going on with the patient, make sure, and it is an artificial airway, so you want to make sure it's patent and it's in that you're assessing their respiratory status. So before and after you do any type of trach care, you want to obviously auscultate their lungs. Make sure you have a good baseline of what your lungs sound like before you take out the, let's say, the inner cannula. If you do have to swap it out or anything like that, you want to hyperoxygenate your patient. Always look at their vital signs, always look at their oxygenation, and even let's say if you're going to do suctioning, so it's important that you hyperoxygenate them. Communicate with them, let me know if it's too much, and normally you're able to communicate and they can tell you, okay, you can suction one more time, or I'm good. And that should be another, maybe I'll add it to the end of this video, I don't know, or a separate video. So anyways, so with just general trach care, get a second person when you're ready to take off the tie, and you loop it on the side you're closest to, and then having someone support the head and then bring it on this side, and just make sure that it is well placed in that you're securing your trach. What else can I tell y'all about it? I think it's overall just it's very nerve-wracking, the skill to do. You don't want it to accidentally come out. You don't want to hurt the patient. It's very tender, especially if it's a very new trach. So you want to take it slow, okay? And always ask for help, especially when you get to the point where you need to take the straps off and replace that. You want to have a second person available, whether that's another nurse, a tech, or an RT available, and you want to chart obviously on what you are seeing. Okay, sometimes you come into work and then you see, let's say, the drainage, or maybe it's a lot more bloodier. You want to compare, obviously provide that information to the oncoming nurse so you can understand where we are on the number of days on the trach and all of that. This may be totally like a different video as well, but understanding your trach, understanding, is he or she hooked onto the ventilator, or are we on like a trach collar, or are we on room air? So you have to assess to find out what the patient's doing. Again, so for some reason or other, the patient needed a trach placed, obviously, to maintain their airway, right? So at that point, basic education to the family members will definitely help understand the entire process. Yes, it's reversible in some cases, and sometimes it's not. But normally whenever a patient is, let's say, intubated and they're going on for X amount of days, they would move towards the trach, which would be a little more comfortable than just being on the ventilator and all of that. So I won't go totally into that. Just overall care, find out what you have to work with. talk to RT, watch another nurse do it, make notes on things that you can improve, talk to the patient, especially if they're able to communicate with you, like shake their head yes or say no or anything like that. Take direction from them, okay? And always explain, I'm going to be as gentle as possible. It is very uncomfortable and it's very nerve-wracking on their end, especially if you're about to suction. I mean, can you imagine feeling like your entire airway is being obstructed by a catheter and you're sucking out not only secretions that they obviously are coughing up, but then, you know, they're also feeling short of breath, okay? So you have to take all of that into account. Yeah, so I hope you got something out of this video. Again, go to your resources, find a list that gives you the exact steps on how to do trach care. Find out what your facility has, watch someone do it, perform it, and then you will go from there. You will get a little more comfortable. But I initially was working with a lot of the RTs when I first started to see them do it, and now I feel much more comfortable. I still am always like, and that feeling is probably still going to be there for a very long time, but I do always get someone else to help me out, especially when I'm getting ready to swap the ties out. Yeah, that step is probably the most nerve-wracking for me. Let's see, I think that's about it. I hope you guys got something. If you have any questions, leave in the comment section below. Don't forget to comment, like, and subscribe, and share the videos. Bye.